A local mother in Salem today. She's hoping lawmakers will pass a law changing policies in Oregon's hospitals. She says a new policy could help save the lives of thousands of newborns. News 10's Molly Trotter's here with more. Molly?
Lindsey Lahr's son of Kaleb was born at Three Rivers Hospital in Grants Pass just 2 years ago. When her son was born, he was deprived of oxygen just hours after he was delivered. That had a lasting effect on his health. And today, Lahr headed to Salem in hopes that she can get a law passed to make form of testing, which may have helped, a regular part of newborn health screening. According to the U.S. National Library of Medicine, pulse ox, also known as pulse oximetry, is a non-invasive method of allowing the monitoring of oxygen levels in newborns. That is exactly what Lindsey Lahr is trying to mandate for every newborn by trying to get her law passed in Salem today. The law is called Pulse Ox Oregon Kaleb's Law.
And a pulse ox is it's just a little device that's placed on the hand or foot that's used for measuring the oxygen saturation and the pulse rate.
Lahr is trying to make sure this testing is mandatory on newborn babies, so the same thing that happened to her son doesn't happen to anyone else. Kaleb was born 2 years ago at Three Rivers Hospital in Grants Pass, and just hours after he was born, his parents noticed his breathing wasn't normal. The problem? He had congenital heart disease and wasn't getting oxygen to his limbs. Having this pulse ox screening become mandatory will avoid heartache like the Lahrs had. A local pediatrician from Providence Medical Medford Pediatric agrees.
I think it's a good idea. By the end of the month, both of the hospitals here in the Valley will be doing the routine screening on every baby that's born.
News 10 also talked with Asante Family Birth Center. A spokesman says every infant born at the birth center receives a pulse oximeter reading before they leave the facility. 1 in every 100 babies are born with congenital heart disease. It is the #1 birth defect in newborn babies, according to the U.S. National Library of Medicine. Covering your news, Molly Trotter, News 10.